معاكم النهارده ان شاء الله دكتور احمد زيدان. هنتكلم على موضوعين النهارده، واحد منهم هو الفيشل انجريز والتاني هو الوند هيلينج والبروسيس اللي بتحصل في الوند هيلينج ده. الموضوع الاولاني بتاعنا اللي هو الفيشل انجريز، لازم نفهم طبعا وكلنا يعني متخيلين الاتيولوجي بتاع الفيشل انجريز. ممكن ازاي الواحد زي اي وند ممكن تبقى رواد ترافيك اكسيدنتس او فايلنس او سبورت هوم اكسيدنتس اوكيبيشنال هازاردز، ممكن تبقى حاجه زي شوت جان انجريز. اللي بيحصل في الفيشل انجريز هو طبعا اكوردنج تو الاناتومي بتاعنا ان احنا بيحصل عندنا سوفت تيشو انجريز، وممكن يبقى فيه كمان فيشل بون فراكشرز بما ان السكال بتبقى تحتينا على طول. طيب ايه انواع الانجريز اللي ممكن نقابلها؟ طبعا اولهم في السوفت تيشو انجريز هم الابريجنز. ممكن الابريجن هي عباره عن open wound that caused by skin rubbing against a rough surface. Abrasions are very common injuries that can range from mild to severe. ممكن abrasion be painful لانها طبعا في nerve endings exposed، وبس غالبا معظم الابريشن زي ما احنا معظمنا جرب بتبقى very superficial وhealed very easily ومش محتاجه اكتر من العلاج المنزلي والغيارات البسيطه. الابريشنز برضه لها ديجريز زي ما شفنا في الحروق، لانها طبعا بتشبه، هو حتى في ناس بتسميها ساعات فراكشنال بيرن. الفيرست degree abrasion involves superficial damage to the epidermis. The epidermis is the first and most superficial layer of the skin. A first degree abrasion is considered mild as it will not bleed usually. In the second degree abrasions, the second degree abrasion results in damage of the epidermis as well as a layer of the dermis. The dermis, which is the second layer of the skin just below the epidermis, and the second abrasion may bleed mildly. The third degree abrasions usually is a severe abrasion. It also known as a avulsion wound. It involves friction, tearing of skin to the layer of the tissue deeper than the dermis. And avulsion may bleed heavily and require more intense medical care. نوع تاني من الوونز اللي احنا عندنا هي الكونتيوجن. والكونتيوجن يعني بيعتبر a wound without skin cut، يعني a wound with a closed skin. عندنا نوعين من الكونتيوجن. كونتيوجن ده ممكن يبقى without hematoma او with hematoma. تمام؟ الكونتيوجن without hematoma is بتشوف swelling and some bleeding under the skin. This injury generally takes a few days to a few weeks to heal. During that time, the bruises will typically change in color from red to purple blue to greenish yellow and then to yellowish brown. On the other hand, the contusion with hematoma is a localized collection of blood in the tissue underneath the skin. Most hematomas resolve spontaneously over time as the blood debris is removed and the blood vessel wall is repaired by the body's repair mechanism. Other time, surgically removing or evacuating the blood in the hematoma becomes necessary based on its symptoms or location, which in some locations where hematoma is intense and underlying structure can be affected by this intensity by stopping the blood supply in this place, like in the eardrum. These hematomas, if tense, it must be evacuated immediately. Lacerations are tears of the skin that result in irregular wound. Laceration may be caused by impact injury from a blunt object or force. In most cases, tissue injury is minimal and infection are uncommon. But however, some laceration may extend through the full thickness of the skin and into the subcutaneous tissues, including the underlying muscles, nerves, and vessels, and all bones. Severe laceration often are accompanied by significant bleeding and pain. Other types of wound are avulsions. Skin avulsion is a wound that happens when the skin is torn from your body during an accident or other injuries. The torn skin may be lost or too damaged to be repaired, and it must be removed. A wound of this type cannot be stitched closed because there is a tissue missing, and you usually need a reconstructive procedure. What is the symptom and sign of injuries like this? The first is soft tissue injuries, swelling, pain and localized tenderness, ecchymosis, bleeding if this wound is open, crepitations from the area of underlying bone fractures, hypoesthesia or paresthesia in case of cutting or disruption of nerve endings. Also, we can see malocclusions, which is classified into class 1 low malocclusion, or class 2 retroganthia, class 3 proganthia. Maybe there is a visual disturbance in case of fracture of orbital case, which results in diplopia or decreased in vision accuracy. Maybe you see facial asymmetry or deformity. Obstruction of respiration can occur. Laceration inside the mouth can be found. On examination, you have to evaluate for the symmetry and deformities in the face. Inspect the face, compare the two sides, palpate all the bones of the face in an ordinary manner, starting from the brow, superior and inferior orbital rims, nose, zygomatic arch, malar eminence, and then the border of the mandible. Inspection for laceration and abnormalities of the Then palpate the dental arch for abnormal mobilities. Maxillary and mandibular dental arches are carefully visualized and palpated for bone irregularities, bruises, hematomas, tenderness, or cryptus. Sensory and motor function in the facial area are totally evaluated. Extraocular movement and muscle of the facial expression must be examined all. Global function, so pupillary size, symmetry, global excursion, eyelid excursion, double vision and visual loss, and fundoscopic examination must be done. For the emergency treatment, first you have to deal with the obstruction of the airway by cleaning of the blood, vomit and teeth from inside the mouth with your finger, inspiration of blood, saliva and gastric content, and early intubation or tracheostomy if needed. What is the indication of tracheostomy here? First, panfacial fractures, combined mandibular, maxillary and nasal fractures, which obstructed the airway, by the way. Severe facial and neck edema resulting from soft tissue injuries such as severe facial burns. The multiply fractured mandible with significant swelling on the neck and the floor of the mouth. Patient who required prolonged intermaxillary fixation, who have significant head or chest injury. Possibility of prolonged post-operative airway problems. Unrelieved obstruction of airway in the region of the larynx or the hypopharynx. All of these are the indications of tracheostomy in case of severe facial injuries. After that, you deal with bleeding. The most simple and effective way is direct pressure or compression on the wound, and it has to be done continuously for at least 5 to 10 minutes. Tying of the blood vessel if identified, so for example the facial, superficial, temporal, angular or external carotid, all these large vessels have to be closed by tying or cauterization. Anterior and posterior nasal packing if you have nasal bleeding. First then you deal with circulation, evaluate associated injuries, which usually happens in this case in scar accident or sport accident or whatever, like cervical vertebral skull base examination, intracranial thoracic or intra-abdominal examination. Diagnosis and treatment of fascial injury after this. Treatment of injury is like any wound, either by primary closure, delayed primary closure, secondary closure, or tertiary closure. The primary closure, the time lapse between injury and repair, is important in terms of possibility of infection and choice of repair technique. Primary closure is treatment tried when possible. It can apply immediately after the trauma if the wound is sharp and clean. In lacerated wound, the debridement, excision of 1 millimeter or 2 of the wound edge is required. In heavily contused, dirty and heavily contaminated wounds are not closed by primary intention. Shotgun wounds, animal bites and human bites also are not closed primarily as well. What about delayed primary closure? The wound must be prepared with debridement and dressing. Cleaning, irrigation, debridement is very important. What causes your delay is your need to prepare your wound. You need that the edema of the wound to subside. And after you do this, the wound can be closed primarily within 48 to 24 hours. If it's clean and free of devitalized tissue or any debridement. What about secondary closure? If the wound is heavily contaminated and infected and contains necrotic and devitalized tissue after 48 hours, the wound be closed after cleaning of the wound or can be left for secondary intention healing. The secondary healing occurs with secondary wound contraction and migration of epithelialization. Here we finished our first part of our lecture.